Hi, everyone. Welcome to Alberta Innovates. Topic is smart investing, smart money in digital health. So this is just a slide to show you all of our wonderful sponsors for this program. My name is Faz Bashi. I'm in Silicon Valley. I'm part of a number of different groups, so I'll leave these marquees up for a moment. My contact info is here as well in case you want to follow up. I'm also on LinkedIn, so feel free to reach out. My slides are going to be about 50% are going to be philosophical, and the other 50% are going to be practical. I'll let you decide which ones are which. I'll also try to keep this to about 15 minutes of presentation and leave hopefully about 10 minutes for Q&A. Meanwhile, feel free to use the Q&A button on your screen to start writing questions, and I will address those towards the end of my presentation. So I want to start off with just obviously some philosophical questions. What is it that we describe as ourselves? Are we really a bunch of numbers, ones and zeros? Is this what really describes who we are? And while I appreciate the term digital health, I also want to plant a seed in your mind about where we can actually take this, because the experience of who you are cannot be translated directly into ones and zeros. So if you're interested in the philosophy, there is a link at the bottom of this slide, and I'm happy to send it to you as well. But I like to think of ourselves as intertwined, and that there is something new perhaps that we can do with all of these ones and zeros that intertwines our healthcare with who we are, what we do, and who we surround ourselves with. So a little food for thought at the moment. We're in a very unusual time. I'm referring to it as LITAC, Life in the Time of Coronavirus. And I'm definitely looking forward to LITAC, where we come out of it, and it'll be life in the time after coronavirus. And for the time being, at least in the United States, it looks like we're going to be in this mode of dealing with our pandemic for a good while, several more months, perhaps a year more. Meanwhile, what you've all witnessed is a tremendous shift, a tremendous catalyst that has hit into digital health, where a tremendous amount of money has gone into investing, $10 billion invested to date, which is 20% of the total that was invested from the time that we came up with the word digital health. Lots of IPOs have been happening. Teladoc and Livongo have become Televongo. There's a lot of things happening that I'm going to try to decipher with you. And so I'm not a futurist. I can't predict the future, but I will try to read the tea leaves with you in this presentation. Lots of folks I know will be interested in the topic of where's the money flowing. And I'm not a big fan of following the money. I'm more of a fan of doing what you love and doing what you're passionate about. And I'll try to give you some hints along the way. Bottom line, it's the best time ever to be a healthcare entrepreneur. So some words of wisdom, you know, in the time when we could all go outside, my first statement to you about learning what is important to be solved here is get out of the building. Get out of the building, go visit customers. Well, you know, even though you can't do it physically anymore, it is possible now to do a lot of traveling through these online platforms, whether it's On24 or Zoom or whatever your favorite is. I have many meetings with people from all around the world now. I don't have to get on a plane and go anywhere. So learn what is the problem and learn it from different perspectives and try to get yourself virtually connected to people so that you understand what is the problem that you're trying to solve. Clearly, on a fundamental level, all of us come at this from different perspectives, but if there was any way of looking at creating a startup in digital health as a protocol, and I'm a scientist by nature, I'm also a physician, but my science background tells me that I'd like to have some sort of a protocol. There's a lot more that goes in than just a recipe, but if you follow any of these resources, which many of you I'm sure have already heard of, but Eric Ries and Steve Blank and Osterwalder, they're all put together excellent resources for you to follow. One of the things that a lot of entrepreneurs in digital or other areas tend to ignore, because you're so passionate about what you're solving, the problems that you're addressing, is the actual business side of it. And so make sure that you give enough time to the business model, what you're trying to develop, and make sure that there is a product market fit. There's lots of business models. The classical ones, especially in digital health, are B2C, business to consumer, or B2B, where you're solving directly a business's problems. There are lots of pros and cons in each area. Given where we are today in the world of pandemics, I'm going to try to lean a little bit more into B2B. That's where I feel most comfortable. But the reality is this new LITAC and LITOC world that we live in is driving a lot of consumerism. So keep your eyes open to, and keep your mind open to the possibility that consumers are going to play a greater role. There's lots of other models where people come up with hybrids of business models, B to C to B, B to C, B to G, to governments, and we're all also seeing a lot more involvement of our governments wanting to be involved. And also we're seeing a lot with corporations wanting to step in where government isn't playing a role. So again, keep your mind and eyes and ears open to all that. I'm going to share with you a number of comments that were given to me by a dear friend of mine, Chuck Stead, who ran Hawaii Pacific Health for a long time. These are words of wisdom. As many people as you can find around you to share these words of wisdom about what they've experienced through 15, 20 years of working in the healthcare systems. Make sure you listen, take good notes. So some very key things that Chuck has always told me I'm sharing with you right now. There's been a tremendous shift in health systems, as we know. They've gone from fee-for-service, where you just get paid for what you do, to different kinds of healthcare reform models, bundled payments. And remember, all of what I'm telling you is USA-centric, but hopefully it applies where you are. And now we're moving into what is known as value-based contracting, value-based approach, where healthcare wants to get something out of it other than paying bills. So keep your eyes open, keep your mind open to where the risk is moving, that puck that is moving from one place to another, and try to track it so that you understand what is moving healthcare in one direction or another. Providers, there is no replacing providers. And I just want to say that over and over again. There is no algorithm that is ever going to replace physicians and nurses and medical assistants and whatnot. So, but make sure that you understand what the providers go through, because the delivery of care, ultimately, while initially it may be initiated by a software system that takes information in, the delivery of that care and that procedure is done by human beings. So understand what their motivations are. And in this world of pandemic, those motivations may have shifted. And you're going to see actually a lot more interest from physicians wanting to be directly involved in investments for what you're doing, directly involved in helping you shape what the digital component's going to look like, and then also help you integrate those into either their own practices or into the community at large. Healthcare systems are struggling like crazy left and right, and it was even before the pandemic, but the pandemic made it even more apparent. So there's a lot of economic pressures right now on healthcare systems, as large as they are, and everything moving into digital, and the convenience of the customer, the consumer who wants, anywhere, anytime, any place. There's a lot of policy that is being pushed for reimbursement models. And then obviously a number of constituents who are playing a big role in where healthcare goes for the systems themselves. Make sure, these are a couple of admonishments also from Chuck, make sure that when you're inventing something for a hospital that you know exactly what happens in it. That's why I said get out of the building or do some virtual visits, whatever you need to do. Don't take money from anyone who doesn't know what happens in the healthcare system. And obviously be aware of the fact that there are multiple pressure points in healthcare right now. And sales cycles, while they were long before, it may be even a little bit longer now. And the adoption cycles are also a little bit more challenging, given the fact that it's a time of pandemic. It's very difficult to be on site. So I know what you're thinking, and this is kind of a transition point for me. You're probably thinking, well, Faz, this is all nice and everything, but what kind of ventures are getting funded? Where's the white space? What makes a venture successful? You know, tell me about the FDA and all these things, and I'll do my best to touch on them. But let me first start off with this. What's your mindset? So if you're looking at being a digital health entrepreneur, or you already are one, and you're only focused on money and money raising, it's the mindset that might get you into trouble. This is a difficult space to be in. You really need to be committed and passionate about things. So there's a great book called Heart, Smarts, Guts, and Luck. Go look it up. There's even a test that you can take. It's a retrospective study, 10 years of a venture fund, and they looked at what made entrepreneurs successful, mediocre, or they just didn't succeed. So figure out what's your motivation and make sure you stay true to that. And the capital that I like to think about is mostly really about the people. It's one of the most important ingredients we all look for when we make an investment. It's who you are, what you know, and who you know, frankly. So all of these factors are so important beyond just money. Money is just a catalyst. So for my investor friends in the audience and those who are thinking about getting into digital health, here are some of the initial ingredients that make a good, successful digital health startup, or a science-based startup for that matter. Focus, focus, focus. Have data, have an understanding of your science and the innovation. Make sure that the people on your team are top-notch, having some experience, having some burnt fingers beforehand, so that you're not really putting all the risk on new investors. If you can put barriers to entry, meaning intellectual property and patents, that's always very helpful. And obviously being open-minded and flexible about your financial strategy, meaning how much money do you actually need to raise. These are absolute important ingredients, and if you'll hear me over and over again, my emphasis usually is on the people part of it. The formula I like to use for all of these factors is 1 + 1 has to equal 6. Why 6? Because it's bigger than 2. And management has to equal a 6. The intellectual property that you bring to the table has to be a 6. The market opportunity has to be big enough, 6. And obviously an exit strategy, because that's usually where we all, as investors, get our ROI, our return on investment, is that there is an exit strategy of some sort. What I look at when I see a startup is I look at it as an economic package. I mean, I love healthcare. I think it's really an important space, and I'm so delighted that everyone is also starting to wake up to the fact that health is so important. But from an investor's perspective, what a startup brings to the table is an economic package. They're trying to convince you as an investor to invest, but there's a lot of risk on the table, and it's up to the entrepreneur to tell the story well, de-risk the opportunity, and to also demonstrate to you a competency of achieving some sort of an ROI. So it's really all about staging the story in a win-win approach, and the better you are at doing that, the more that you will see the opportunities grow for you. There's lots of intangibles that come to the table when you're looking at a startup and what makes it successful. The advisors, again, people part of it. The board members who are already on board. These are people who are already committed, who already have a contract in place, may have already invested, but they are deeply committed to the team. The investors, the mentors, the team pedigree, the customers, these are all some of the intangibles. And by the way, service providers. My typical first question will be, who's your corporate counsel? Who's your IP counsel? Because I want to know that the first hires that an entrepreneur will make, are the good ones. So again, a lot of this has to do with people. Now, what can an entrepreneur do to make all of these things a positive experience for the investor? And that's called due diligence. So it's really up to us as investors to ask the right questions, to look for that unique value proposition, to look for the success factors, to obviously, I emphasize here, the management team, making sure that there is a sound business model. All of these things are factors to consider And it's not easy. There's a lot to consider, and it's not just about writing a check. So this is from the investor side. Now, what can the entrepreneur do? Well, if you empathize with your investors, which you should, then you'll make the due diligence experience as easy as possible for both sides. So the best experiences I've had is when the entrepreneur has basically already had a deal room, already anticipated that I was going to ask a lot of questions about contracts and employee contracts and business contracts. They allow me to come and visit as often as I want to. Some I even take months to just be just a fly on the wall and just experience what they go through. Making due diligence and making the process of answering questions transparent, it's just such an important part of the whole experience, and that's what makes a good investment. So this is my wrap-up point. I see there's several questions already in the Q&A. Please go ahead and post your questions in there. I can elaborate a little bit more. I can also talk a little bit more about what we're seeing as trends. But I'm going to wrap it up with this acronym as well, BYN, BYNI. So a lot of what I've already emphasized is about people and the process of who you are, what you know, and who you know. And BYN, BYNI is just my way of reminding everyone, build your network before you need it. It's very hard to build a runway as you're trying to fly into the sky. It's very difficult to do that. So do it ahead of time and do it in a very methodical, meaningful, and transparent way. So thank you for listening. I'm going to jump over to the Q&A section now. I'm just going to look at some of these questions that have been asked. So one question from Graham comes across as, can digital health companies get your attention if they are pre-revenue? I'm going to answer right away, Graham. A lot of what we see as early stage investors is early stage, meaning pre-revenue. And the absolute answer is yes. And it really depends on the story that you're telling and the problem that you're trying to solve. What might make you want to invest in a pre-revenue digital health company? How important is revenue? Well, revenue tells me that you figured out product market fit and that you have customers who like your solution and are willing to pay you money for it, and you figured out how to make an incremental profit on top of the money that they're paying you. So while, again, revenue is a really nice thing to have in place, as an early stage company, there is still a lot that you need to prove out. So I listed it under 1 + 1 = 6. So management is a very important part of the ingredient. I need to know that I can trust you, that you're an honest broker, that you have information that you're willing to share, and that your team is also the right group of people at the table to help move this along. Because it's not, remember, there's a lot of revisionist history out there about what makes success. And as much as you might think it's one person who leads everything, it's not. It's all team effort. And remember, my acronym for team is together, everyone achieves more. So I hope that helps, Graham. Feel free to post another question if you'd like to. I'm not seeing any other questions, but I can pontificate a little bit more. Feel free to, again, put more questions in there if you'd like to. There's a lot of trends that are happening right now because of the world that we live in, which is the pandemic world. And the drive to get things to be more digitized is huge. It really is. I mean, digital health in its previous form was called healthcare IT. Healthcare IT has been around for 30, 40 years, and telemedicine has been trying so hard to get a foothold. And now look at where we are, where everyone now really sees the value of having that telemedicine presence and that infrastructure already in place. So I think we're going to see a lot more, and it's not just me pontificating on this. I'm sharing with you a lot of my readings. Consumerism finally has some legs. Virtual care is now part of the hybrid model of physical hospitals and all these. And And then we also have to think about what is the meaning of a physical hospital anymore? Do we really need to go physically be anywhere other than for procedures? There's a lot of cash that's coming in, but be wary of that cash. A lot of it is going for later stage deals, but that cash that's going into Televongo, that means those companies are looking for deals. So there may be some things to be aware of. And engaging patients is so important too. Wow, we're getting a lot more questions now. This is great. I am going to jump through them right now. Let's start with the story of Theranos. Oh, somebody's asking about Theranos. So if you know the inside story of Theranos, this is a unfortunate story, and it has nothing to do with male or female, although the media seems to press it mostly on the fact that Elizabeth Holmes was leading this effort, and that's unfortunate because there's plenty of other stories about untrustworthy people who mislead the investors. But Theranos is still part of the vocabulary, the mantra that people speak about, and we all are wary about that. I already emphasized how important trust is. So people are the biggest part of this. Who's on the board? Who's the advisor? Who are the investors? And again, I'm not going to pick on people, but when you look at some of the board of director members of Theranos, you'll see a lot of people who had nothing to do with healthcare trying to basically get an ROI with her story. Let me go to Victor. It's known that one of 10 companies dies in the first couple of years or so. What is the number with the help of a venture investor? And venture investors are no different than entrepreneurs. Choose wisely. They're not all the same. So it's a great question. And you can go to Heart, Smarts, Guts, and Luck and read the 10-year retrospective, which is unusual for a venture capital firm to want to even reveal that they had failures. But yeah, most venture funds fail. It's a reality. And success for a venture fund means that they get 3x back the initial pool of money that they have. Good discussion, a variety of audience members. Okay, great. Thank you for that. Brad, what are the areas in the space of mental health you see becoming a priority for government? So important. Glad you brought that up. That's why I started off with philosophy. You are not just ones and zeros. You're a set of experiences manifested through this body that you carry around with you. So you put into that body a lot of things, including stress, including things that affect your mental health. And so I think mental health is becoming more and more of an obvious area of need because we are all tremendously stressed out. Now, there are some simple solutions too. So do not try to make it complexity out of something that could be very simple. So taking care of your mental health means giving yourself time and space, meaning trying to be mindful. Some of the simple solutions to being mindful are basically going out for a walk, getting exercise, eating a good diet, and the other thing is get a pet. Yeah, dogs and cats and horses and other things really are simple solutions, but there is absolute room for mental health. So thank you for that question. Low resource setting jurisdictions navigate the options of where and how they should invest in digital health and what will you do? Complicated question. I'd love to take that offline with you, so please feel free to shoot me an email. More about exits and acquisitions. So look, there's a lot of big companies now being created in the digital health space. Televongo is just one of them. And I already mentioned just in the past 12 to 18 months, $10 billion of money has poured into digital health. Most of it towards later stage, about 20% perhaps towards early stage. But these big companies now are looking for acquisitions too. So acquisitions are not just left for corporate partners, large entities. So the IPO market is definitely opening up more and more. So it's a mixed bag. But again, I would not start a digital health company. I would start with a strategy of what your exit should be. But I wouldn't start it with, I'm going to get an exit tomorrow. It's a journey. You don't know, you cannot predict things the way that you think you might. I never predicted COVID. None of the VCs predicted COVID. But you should take this journey with the people that you want around you and add the value that you can going forward. And again, more philosophy. Would you say that revenue generation leads to more investments? The answer is a very simple yes, but it also depends, right? So even if you have revenue, there can be a lot of reasons why people may not want to invest. And again, a lot of it may have to do with intellectual property, may have to do with management, but revenue in general is proof positive that the market wants what you are offering and is willing to pay capital for it. That means you figured out product market fit, and now you need more capital to grow in that area. Great question. What does failure of Haven show for the future of medtech in 2021? You know, so corporations are all trying, Haven, the Amazon, Berkshire Hathaway approach to healthcare. And so that may have been just a bad timing on their part. As I said before, while governments are trying to figure out exactly how to be a player and a mover in healthcare with policy, that's a long road. We have some foundational elements in place, but the reality is, I think where the rubber is going to hit the road is a lot of the corporations and the existing infrastructure that we have in place, meaning drugstores, some of the even places where we purchase food and other products. Large corporations are probably going to be doing a lot more to keep their employees happy, healthy. If they need to have hybrid work environments, how do you provide, you know, mental health in a Zoom session? How do you provide access to telemedicine? So I think there's a lot more to be looking at here rather than Haven as an example. So I wouldn't, I'm not betting anything on Haven or other models like that. You mentioned not taking money from investors who are not knowledgeable, passionate about the problem. How do you as an angel investor get involved with your companies? I'm very much like many of my friends. I roll up my sleeves. I like to be involved. And so that's your job as the entrepreneur, is to make sure you're interviewing folks properly and making sure that you want the right people at the table to work with you. And I'm also seeing that I'm slowly running out of time, but these are great questions. Is innovation copyable? Great question. Look, I said it many times. There's a strong emphasis on people, and any ecosystem that brings people together in a sharing kind of way, any ecosystem where service providers and entrepreneurs and universities and corporations are all willing to wrap their arms around entrepreneurship, then that's an ecosystem that can thrive. But those that are just trying to copy Silicon Valley has a lot of problems, and I wouldn't copy the things that we do out here. But yes, there are ways of doing it, but it really relies a lot on people. And then the lean startup, what do you see? What do you like to see built out in front of you when you start looking at investment opportunities? You know, I think if you go back to those 4 bullet points that I mentioned earlier, you know, management, IP, market, go-to-market strategies, exit strategies, those are the fundamentals of where it makes a big difference for investors. Now, I could give you an entire checklist of all the due diligence items I look for, but a lot of that is logistics. Much of what we do as human beings and not algorithms is connect with one another. And that's an important part of what you bring to the table, and hopefully what we as investors bring to the table too. This is a people business. Enjoy the process of getting to know people. Money is a catalyst. It's not the most important thing. I know tons of entrepreneurs. I'm an entrepreneur myself who basically just know how to be scrappy. And I love meeting those kinds of entrepreneurs who want to have investors but don't necessarily need the money because they know how to create a business. So with that, I'm just going to wrap it up. I think we've got a couple of seconds left, but you know, we're on this last slide that I have up still. It's build your network before you need it. Very important message. So I hope all of this was helpful to you, and good luck with what you do. And healthcare is so important. Thank you for being a part of it.